Welcome back. Healthcare startups are booming. The number of venture-funded deals jumping 200% from 2010 to 2014, driven by reforms in aging population and the adoption of technology. Want to bring in Steve Krein. He's Startup Health CEO. And Steve, it's good to see you. Thanks so much for joining us.
Great to see you again. Thanks for having me.
Yeah, when we talked the last time you were here, we were talking about this marriage of healthcare and technology. There's a lot of things going on really supporting arming ourselves with the right information to get a handle on our own longevity.
Yeah,
what's going on?
We're seeing a convergence of all the macro conditions that I think entrepreneurs dream of. It's actually the best time in history to be an entrepreneur in this sector because in addition to healthcare reform, you've got mobile health, you've got the global discussion around healthcare, you've got the aging population, the acceleration of cost. But for entrepreneurs, you have the unique opportunity to get access to resources you never could have before. Angel investors, corporate investors leaning in to help you get really early pilots in areas where you never would have had a chance to do so.
And
before.
for a long time, you had the performance there because, you know, you would invest in these healthcare deals and you would win big. This year, we saw a real rolling over of healthcare companies.
Well, last week in particular,
right.
You saw, biotech now down 22% since July. Does that, ripple anything?
Yeah, does that change things?
No, look, for this, we're talking about digital health. We're talking about the mobile devices, data.
Right.
Really, the non-life science businesses being created and a whole generation of entrepreneurs reimagining every aspect of the care delivery system.
Steve, I'm old enough to remember in 2000 sitting with John Arnold when he started WebMD.
Yeah.
Merged in with Healthion, or actually he started Healthion, merged in with WebMD and Medical Manager. 16 years later now, why is this different?
Yeah, well, these macro conditions are different. I think it's this golden age of entrepreneurship, and I think healthcare is the last, probably with education, of the industries to be disrupted. And entrepreneurs are leading the way, and I think all of these conditions happening at the exact same time. Healthcare reform is a big instigator of it. I think a lot of companies see it, instead of looking at healthcare reform as a negative, they're seeing it as a treasure trove of opportunities to create new businesses.
So 16 years ago, they were just too early?
First generation, absolutely. We're now at a whole new generation, solutions that you never would have imagined. Think about what you can do with Uber and delivering yourself around the city or around the world. You can do so now with healthcare, too.
Well, what about Startup Health? Tell us about it.
So we're a health innovation company. We see the entrepreneurs needing much more than money, and the notion that you can actually wrap a whole suite of services around these entrepreneurs is big. So we have a coaching program to help the entrepreneurs develop their businesses. We have a network of all the stakeholders that have leaned in, that are not just investing, but are really willing to provide advice and expertise. And the biggest thing that we're doing is really bringing corporate investors and corporate partners. So GE, Aurora Healthcare, Kaiser Permanente are organizations leaning in to the early stage development of these companies, and they're partnering with Startup Health to do that.
You're going to do another money raise?
We're in the middle of one now. We actually just started, announced the first close. Aurora Healthcare in Wisconsin's leading the next round.
Congrats, Steve.
Thank you very much.
Thank you so much. Steve Krein there, Startup Health. Big week.